Going. I'd like to call the meeting of the board to order. Will the secretary please call the roll?
Director Bott? Director Bott?
Here.
Thank you. Director Curry?
Present.
Vice Chair Deere? Is absent. Director Garza?
Present.
Director Harrington?
Present.
Director Kim? Is absent. Director Heading?
Present.
Director Prendergast?
Present.
Director Ryder? Is absent. Director Robinson? Is absent. Director Story?
Debbie, I just got a text from Director Robinson saying that he doesn't have a link to the meeting.
Okay, I will resend it to him and we'll get him connected in. Thank you, Director Story.
Thank you, ma'am. Good morning.
And good morning. And Chair Taylor?
Present.
You have a quorum.
Thank you very much. Pursuant to the Illinois Open Meetings Act, meetings held remotely will require roll call votes for all action items. To streamline, we'll combine the action items into a combined motion. Meetings of the CCH boards committees will be held remotely. Notice due to the termination of public next regular meeting. The board will be held on Friday, January 27th at 9 a.m. The first item on today's agenda is employee recognition, which will be reviewed by Craig Williams, the interim CAO of Operations and Development. Mr. Williams. And we'll work on
unless it's just me. The sound is really problematic.
It's not you. I was making a comment. I know we're working on trying to fix the sound. Thank you.
Good morning. Everyone can hear me okay?
We can, thank you.
Great. This is Craig Williams. I'm Interim Chief Administrative Officer for Cook County Health, and I'm going to go through the recognitions and new leader hires. Next slide, please. So very exciting. The Stroger Hospital 20th anniversary is December 12th, 2022. We're having an event at the Stroger in the Stroger cafeteria on December 12th at 4 o'clock. A video about the history and more details about history are available at cookcountyhealth.org, Stroger Hospital 20th anniversary. And each word in that has a hyphen. Next slide, please. CIRMAC, after a thorough survey,
Sorry, go ahead. Sorry.
Okay, thank you. After a thorough survey, the National Commission on Correctional Healthcare, the NCCHC, will continue to accredit CIRMAC Health Services for its compliance with their standards for opiate treatment programs in correctional facilities. Accreditation by NCCHC signifies that CIRMAC meets the nation's premier standards on correctional healthcare. CIRMAC is one of the few correctional health sites in the country that has been accredited OTP. I toured CIRMAC a few weeks back, and I have to say it's a very impressive organization. I was really overwhelmed by what they're doing there. Next slide. Thank you. The Illinois Commission on Diversity and Human Relations honored Cook County Department of Public Health Chief Operating Officer Dr. Lamar Hasbrook as 53rd Annual Dr. Martin Luther King Jr. Remembrance Dinner on November 19th. The theme of this year's event was heeding Dr. King's call for healthcare equity. Dr. Hasbrook was recognized for his role in advancing healthcare equity during the COVID-19 pandemic. Next, Debbie. Andrea Gibson, our Cook County Health Chief Strategy Officer, was selected to participate in the Carol Emmett Fellowship Class of 2023. Ms. Gibson was one of 21 women leaders selected across the U.S. The Carol Emmett Fellowship is dedicated to increasing gender equity and diversity in healthcare by focusing on establishing pathways for accomplished women to senior healthcare leadership and governance positions. Congratulations to Andrea. Next slide, Debbie. The National Forum for Black Public Administrators, the NFBPA, Chicago chapter, Director, recognized Shannon Andrews, our Chief Equity and Inclusion Officer, with the Mark of Excellence for exceptional years of public service at an award ceremony on October 29th. At the event, CCH Board of Directors Vice Chair and Cook County Commissioner Dennis Deere, the 2nd District, was honored with the President's Award. I was at that event. It was a really great event. Shannon's art spoke eloquently about her. It was amazing. And I believe Commissioner Deere's sons awarded him. It was great. Next slide, please. Dr. Benjamin Emba, Associate Chair of Medicine for Faculty Development and Associate Program Director for the Internal Medicine Residency Program, was appointed the American College of Physicians Illinois Northern Chapter Governor-elect designee. Dr. Ember will start his 4-year term as governor in the spring of 2024. As governor, he will serve as the official representative of the college for the Illinois ACP, American College of Physicians, providing a link between members at the local level and leadership at the national level. And for new leaders this month, so for new hires, we have Carrie Ann Burke, who started as the project manager for support services in CORE, Maritza Gutzman, the corporate communications manager and public relations, Felicia Hale, managed care clinical operations manager and clinical services, Deanna Reed, our manager of quality of care and population and managed care. Next slide. Allison Horton, communication managers and public relations. Mito Liho, physical therapy manager and physical therapy. Sheila Perquez Porter, director of public health communications for public health. Andrew Ramel, the director of quality improvement, hospital-based services, quality, and patient safety. Next slide. Marco Shelby, our director of care coordination and complex care management for health plan services. Sherry Spencer, director of medical surgical nursing and nursing administration. Tony Thomas, occupational therapy associate manager, occupational therapy. And Austin Young, senior operations manager of health, Cook County Care. And congratulations on promotions. Denise Gilbert was promoted to Chief Nursing Officer for the Department of Public Health. Priyang Baxi was promoted to Senior Director of Business Operations and Finance and Nursing Administration. Gina Taglia was promoted to Director of Systems and Operations in Nursing and Nursing Administration. Rochelle Cassambra was promoted to Director of Delegation and Vendor Oversight for County Care. And Laurie Howard was promoted to Manager of Juvenile Justice Care Coordination and Behavioral Health. I think that might be it, Debbie. Oh, sorry, one more page. Sorry about that. Jerome Pagel, Jerry, was promoted to Security Information Officer for HIS. Alicia Patel was promoted to Associate Medical Chairman of OBGYN. Emily Lupo was promoted to County Care Director of Population Health and Performance Improvement. And Ina Mahapra was promoted to Chair of the Division of General Medicine within General Medicine. Thank you.
Thank you, Mr. Williams, for the update. We actually salute and congratulate all of those who received awards and recognition, as well as all of those welcome the new hires and congratulate those who recently received promotions. Well done. We're going to take my report out of order to consider the resolution recognizing the work of a longtime employee, Dr. Lily Hussein. Madam Secretary, can you please read the proposed resolution honoring Dr. Hussein into the record?
Certainly. Whereas Dr. Lily Hussein has worked as a physician for more than 50 years at John H. Stroder Jr. Hospital of Cook County, providing compassionate cancer care to some of the area's most vulnerable patients. And whereas Dr. Hussein moved to Chicago in 1966, having been born in Mosul, Iraq, and whereas Dr. Hussein graduated first in her class from the University of Baghdad College of Medicine in 1964, and whereas Dr. Hussein finished her medical internship in Connecticut and then completed her residency and oncology fellowship at Cook County Hospital, and whereas Dr. Hussein continued her service to the people of Cook County in 1971, joining the staff as an attending physician, and whereas Dr. Hussein has spent the last 50 years since ensuring that our patients have access to the best cancer care. And whereas Dr. Hussein is currently Cook County Health's longest serving physician, and whereas Dr. Hussein is a trailblazer. She was one of the first board certified oncologists at Cook County Hospital and has trained countless physicians since, ensuring excellence in future generations of cancer care teams. And whereas Dr. Hussein has countless grateful patients whose lives she has improved and whose lives have been extended thanks to her expert care. And whereas Dr. Hussein has always treated patients and their families with dignity and compassion while going above and beyond in an effort to bring them comfort and understanding when they most need it. And whereas Dr. Hussein has repeatedly said she treats her patients like her family. And whereas Cook County Health Board of Directors and the thousands of patients Dr. Hussein have treated are indebted to her for her exceptional clinical skills and her dedication to patient care. And now therefore be it resolved that the Board of Directors of Cook County Health does hereby gratefully acknowledge Dr. Lily Hussein for her remarkable career of service and dedication to the mission of Cook County Health and the people of Cook County. And that concludes the resolution.
Thank you very much. I'd like to ask the board for your consensus via voice vote for the approval of the resolution. All in favor?
Aye.
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 All opposed? Thank you. The resolution honoring Dr. Hussein is approved. Well done. Wish you well, Dr. Hussein. Thank you. The 2023 meeting dates for the board and its committees have been finalized, and they are now being officially released for the public distribution. Board meetings will continue to be held on the last Friday of the month, with the exception of the end of the year, as we have an abbreviated schedule similar to this year. There is no board meeting scheduled in November, and no regular committee meetings are scheduled in December as of this year. Also following the same pattern as last year, audit and compliance and managed care committees will be held back to back on a quarterly basis. Finance and QPS committee meetings will be held back to back on a monthly basis, and HR committees will be held on a quarterly basis, piggybacked after finance and QPS committees. Although we don't have regular committee meetings set in the month of December, we do have a meeting scheduled for the QPS committee for the specific purpose of approving credentialing matters. Given this, I'd like to, as this is the end of the year and our last meeting for the year, I'd like to thank the CCH staff and team for all the work that they've done to support the constituents in Cook County and serve them well and give them the best health care available. I'd also like to thank the board for all of its continued dedication and work as well on behalf of Cook County, and also, quite frankly, and all of the staff that support us, including our board secretary, Debbie Santana, as we go into the holidays. Thank you. The next item is public testimony. Madam Secretary, do we have any speakers who registered to provide virtual or oral testimony?
We did not receive any registrations, nor did we receive any written testimony.
Thank you very much. The next on the agenda are the board committee reports. The minutes of the October 28th board meeting are being presented for your approval. Approval will take place in the combined motion later in the meeting. Are there any corrections or revisions that need to be made to the minutes? Hearing none. Next, Director Pendergrass will review the Human Resources Committee meeting minutes.
Okay, good morning, everyone. Good morning, everyone. Thank you, Chair Taylor. First, I'll start by saying happy holidays to everyone. The Human Resources Committee met on Friday, November 18th at 12 noon. The next regular meeting of the Human Resources Committee will be held on Thursday, February 16th, again at 12 noon. No, we are not planning to have staff re-review the report from the meeting. If any additional questions are raised regarding the presentation metrics contained within the minutes, staff will be present and ready to address. The received report, which is included within the minutes, we had a report from our Chief Human Resources Officer, Ms. Valerie Amos, including information on the following subjects. The FY22 impact summary. This included the hiring and turnover and separations. FY 2022 CCH HR activity report, which included highlights of the hiring updates year to date, separations and turnover. We had status update on our recruiting and job fairs, as well as the HR technology roadmap. We did have some action items. The committee considered 4 CBAs, which included an economic package, wage increases, and healthcare between County of Cook and SEIU Local 20 CTW/CLC, representing ACHA attending physicians and dentists, CERMAC Health Services attending physicians and psychologists, Providence Hospital attending physicians, and Stroger Hospital Core Center attending physicians. The committee also considered proposed amendments to the CCH severance policy. The CBAs and proposed amendments to the CCH severance policy were fully reviewed by the committee in a closed meeting and were recommended for approval by the committee. They will not be re-reviewed today, but if any directors have questions, we are holding off on approving the minutes until we can hold off approving the minutes until the questions are answered in a closed session later this meeting. Otherwise, if there are no questions, the minutes are being presented for approval to be included in the combined motion that will be made a little later in this meeting. Upon approval of the minute, that confers board approval of the CBAs and proposed amendments to the severance policy contained within the minutes. Are there any questions that need to be addressed in closed session? Okay, well, seeing no hands, please hold for a combined motion or after a closed session. If there is a closed session, if there are questions on the CBAs or proposed amendments to the CCA severance policy. And that completes my report on our HR Resources Committee. I will turn it over to you, Chair Taylor.
Thank you very much.
Okay.
Thank you. And happy holidays to you as well. We appreciate it. Next, Director Curry and Aaron Galiner will now review the Managed Care Committee metrics. That committee did not meet in November, so the metrics are being presented directly to the board.
Thank you, Chair. Thank you, Chair. The Managed Care Committee, as noted, did not meet this month. The next regular meeting is scheduled to be held on Friday, January 20th at 10:30 a.m. The committee is due to present metrics, so Aaron Galiner, the Chief Administrative Officer of the Health Plan Services, will review metrics today. No motion is needed. The metrics are presented for informational purposes only. Mr. Galiner.
Thank you, Director Curry, and good morning, directors. We'll start today with our usual membership metrics. Deb, I'll let you go to the next slide. So total membership as of November 3rd is just shy of 444,000. Looking forward into December, we're right at the 450,000 mark, so approaching yet another milestone in membership for the health plan. The next slide shows our managed care market data continuing. This data is through September, so we continue to be a little bit delayed in terms of the data that we have available from the state for the overall market, but continue to be in the 32.5% range for overall market share. The next slide shows our overall growth versus the Cook County Medicaid managed care market. You can see on the left there that we continue to track very closely with the overall market growth. And we've grown just around 4% over the past 12 months versus the overall market at about 3%. The next slide shows our comparison versus budget. So this will roll forward next month. So you'll begin to see our fiscal year 2023 budget numbers, but this shows the completion of fiscal year 2022. As you know, we've significantly exceeded the budget this year with red bars due to the delays in redetermination with the extension of the public health emergency, which we surpassed the next 60-day notice period, and so the next potential end date of public health emergency is now mid-April. So we'll continue monitoring that closely and the potential impacts of redetermination. The next slide shows our core operating metrics, so call center SLAs and claims and encounter acceptance. I will make one note here that the quantitative SLAs on the call center are within our SLA benchmarks. However, there are some additional measures we look at around quality performance of the calls. So how quickly the calls are getting resolved and the information being accurate. And we are monitoring some negative trends around just the overall quality performance of the calls. So that's something that we'll continue to monitor and note back to the board as we watch that. The next slide shows our inpatient admissions per 1,000. Red bars are the prior period, blue bars are current period, and then light blue are projected. So you can see generally we've been trending below the prior period in terms of admissions per 1,000, with some uptick that we're seeing here towards the end of the calendar year. The next slide shows our COVID vaccination rates broken down by age and by dose. So as you would expect, you see higher percentages with the older adults and lower percentages in the younger age categories. Director Harrington, do you have a question?
Yes, I do. I'm wondering what the definition of acute is. I did the previous slide. I'm just considering what acute admissions are. What constitutes that category? You said acute admissions.
Yeah, so those are inpatient medical and behavioral health admissions.
Thank you.
Chair Taylor, did you have a question too?
Actually, yeah. So one slide back, or actually even before that, you mentioned that the call quality of some of the issues around the calls are you're watching and trending. Is that because are we seeing an increase in call volumes? And if so, what's driving that increase?
Yeah, so we are seeing some increase in call volume just with the membership growth. We're also starting to go through some of the open enrollment period, which also sees an uptick of calls. But there's also been just some newer staff that have been onboarded there. And so part of that is just ensuring that training is catching up with the staff and ensuring they're fully prepared before they hit the floor to answer calls accurately.
Okay, thank you. Thank you very much. You're popular. I think Kenny was next in the box.
Yeah, I know I keep asking this question, but the numbers keep not changing. Is there anything else we can do to improve our vaccination rates? As we approach winter, all of the evidence is that we're getting COVID variants back in the market. And some of these rates, particularly for the boosters, are real low. Man, we'll save ourselves a ton of money in addition to improving the health of our population if we can just get some of these numbers up. I mean, I know you're working on it, but boy, I just want to stress that would be a good thing.
Yeah, thanks, Director Ketting, and absolutely. So we're continuing all the avenues we've got for outreach and education to our members. We've also recently made some additional changes where we've increased the member incentives that we're offering for getting vaccinated for COVID, as well as we added a flu shot incentive just recently as well. Previously, our COVID vaccination incentive was only on the initial dose and was for $25. We've now increased that to be $50 for the initial dose, and we've added incentives around the boosters as well. And we're hoping that'll help drive some uptick, and that also gives us a better mechanism as we do outreach to engage with the member, and that we can talk to them about that financial incentive, as well as obviously the general health education around it.
Good, I approve.
Yeah. So gonna hop in here. Thanks. I was just following with Director Ketting's commentary, and thanks again for your work and the work of the team. It seems to me that what I heard was there may be additional resources to meet people where they're at. Like when we look back at how racial and ethnic disparities were closed to a certain extent last year, it was when we went to people as opposed to waiting for them to come to us. And so thinking about leveraging new resources that I think are coming forward to do that, and some of the strategies you just talked about, but also, what is the interaction with the FQHCs that see a significant amount of county care patients? Certainly I do in my clinic, and what role can they play to help around vaccination? So has there been a conversation, with that group and bringing them together?
Yeah, thanks for that question. And absolutely, that's we think one of the best mechanisms to be able to outreach to the members the most effectively is when we can do it through the provider group, and particularly the PCPs who the members trust. So we've got a number of different ways we're trying to work with our provider partners around that. It's obviously a topic anytime we're talking with them, and we also have information that we share out regularly with them that shows what members, what their vaccination status is, so that they have that information available to them as members are coming into their clinics. And then as we also look to build and develop our outreach team within County Care, which is a relatively new team that we're trying to build, part of their work will be trying to partner with providers on doing events in the community that can also help increase COVID vaccination rates. Director Harrington?
I think Director Curry had his hand raised before me.
Okay, thank you, Director Harrington.
Curry.
Just a couple of comments. And if I'm ahead of your presentation, Aaron, do we have any information? I'm looking at the triple threat that we're dealing with now with the flu and with the RSV. If we're able to begin looking at some information on how we stand relative to that. Interestingly, I got some information yesterday overall, in the term, I guess, that's been used, that people, general population, it's just vaccine tired, exhausted of getting these vaccinations. But across the country, and this is not adjusted for urban, rural, or population, you have that, only 25% of adults right now have gotten flu shots heading into the season at this point. It's a little higher for children at 40%. So if I could ask going forward, if this is the proper report to have it, to get some statistics and performance and where we stand with those, if you don't already have that, and we'll be presenting that. Thank you.
Yeah, happy to add that in, and we can share that at Managed Care Committee and in our January meeting.
Thank you.
I just want to piggyback on Director Ketting's concern and Director Bott's suggestion. And as a system, I'm not sure and haven't seen anything, but do we have any kind of marketing campaign around vaccines and trying to push people to become vaccinated against some of these conditions? And that may not be a question you can answer, but I think that as a system, we have an obligation and opportunity, and I see Dr. Hasbrook has raised his hand, that to actually come up with a campaign, particularly one that targets the people most likely not to get vaccine.
Yeah, I'll let Dr. Hasbrook offer his comments.
Thanks, Aaron. So if I may, yes, we have exactly that great entree. It's called boostupcookcounty.com. We launched it in November with the presser. I believe the president was present for that, Mr. Roach as well. It's going to run 6 months. It is targeting those high risk, low uptake communities, but it's also including the broad of suburban Cook County and the larger Cook County through our media partners, iHeartRadio and WCGI and some of the others. So that is a campaign that is actively running. And we've seen some relatively good results in terms of trending up. Again, there is a lot of, I think, fatigue, pandemic fatigue and booster fatigue out there. But we are going broad and wide with a lot of digital ads, wrappings, media, and a lot of additional things. We're tying it also to our hyper-local vaccination clinics. And essentially the campaign is, and we can share some of these slides maybe next time. The campaign has the tagline of give yourself the gift of health, or give a loved one the gift of health through the booster. So we're really trying to tie it into the holiday season, which is also corresponds with the flu season.
I think that I see Ileana Mora, your hand is raised.
Yeah, I just wanted to add from the primary care side, in our vaccination sites that were open to the community, we also, and if you all remember with the MassVax, we also have a database on our microsite where we do plan on reaching out and working with our marketing and communications department. We have already letting everyone know that we have the bivalent vaccine, how easy it is to sign up, walk in, whichever one you want. So we have already done that. And we do have plans to continue that because we do remain open to the community at our community sites.
Director Story.
Yes, I would be interested, Ileana or Aaron, to comment on, this is a captive audience. These are our patients, they're seeing our doctors, our providers. What are we saying to these individuals when you look and say only 50%? From a personal experience, when I visit my PCP, and this, once again, just my experience, I get at least 3 questions around vaccine and my status, et cetera, et cetera. So how encouraging would you all say our medical staff is and other providers are in trying to drive these numbers north? Thank you.
I'll respond from the primary care home. We certainly, this is integrated into part of each one of the visits. It's available there on site. They can get boosted there right away. And it is part of the providers and even the medical assistants talking to them about, have you received your booster? So it is integrated.
So why do you think, Ileana, there's such hesitancy, with this population, when you have your medical assistants and the other providers, wrapping their arms around their patients and saying, you come to us because we're trying to uplift and enhance the quality of your life. Why do you think there's such hesitancy?
Yeah, I think I would agree with Dr. Hasbrook. There is vaccine fatigue. They've now gotten lots of boosters. So I think that's certainly one of the aspects. As well as I would say, there's still some of the other factors that exist, around, whether or not the accuracy of the vaccine and all of that. I think there probably is still some of that.
Yeah, and I'll just add a comment, Director Story. I think the other thing that maybe we can share around this is when a member has had a PCP visit, what the vaccination rates look like, because the other key component in this and an outreach push that we're doing very heavily across the plan right now is ensuring that our members are getting in to see their PCPs at least every 12 months. So I suspect that if we were to look at these rates between who's actively gone in and seen a PCP versus those who haven't been engaged in their healthcare for the past 12 months, that there'd be quite a bit different result.
I would add just one other thing, Director Story, that this is consistent with what's happened nationally in terms of, vaccination rates for that third dose. And we're experiencing similar rates as the rest of the country.
And the last item that I would add is that our vaccination rates look a little differently because we're a Medicaid population. So if you can see, the children from 1 to 11 is 108,000. And nationally, the vaccination rate for children is much lower than it is for adults for various different reasons. When it came out, the time for exposure, others. The American Academy of Pediatrics has really taken this, to really show what has happened. And you can see that even in some of the populations of children between 6 months, it's only about 10%. It goes up to about 38% after when you go up over the 10 months to a year, 5 to 11. Then it goes to 68 between 12 and 17. So you can see that we're sort of mirroring that across our spectrum of population. And so we will continue to work with what we can do to really be able to move forward. But if you really look at it by demographics, which you usually hear on the news, that's in the 70, 60 percentile is adults. And so you can see we're around that, especially seniors having the highest pickup rate. And you can see that our greatest challenge happens to those under 11, like the nation. And that's where you have 27%. And, you're seeing 12 to 17 nationally is somewhere in the 40s and up to 70s in some states. We're at 59. And then you see pickups. So it really is a different demographic. So I want to make sure that we're comparing apples to apples, oranges to oranges. When you hear that rate, it's not the national rate's usually the adult rate, and we're much closer to that. And nationally, the child population is something that needs some more education, some more, I guess, closer contact with their pediatricians and with how they can visit to engage them and assure them that the science behind this is a sound choice. And so we definitely are working with that. We've also built into our Cerner record that has a flag that demonstrates if this individual has not received their COVID, and it's an opportunity for education, and providers are able to do that as Ms. Moore discussed. So we have all things that we're working forward. There's always more that we can do, and we'll continue to follow the guidance from the American Association of Pediatrics on what we can do to engage further with our child and infant population.
Thanks for the clarification and highlighting that. That was one thing to noted. Looks like we have a couple of more hands. Director Harrington.
Yeah, given the amount of discussion we're having about this, obviously it's a concern not only to the board, but to staff and leadership of the system. I want to offer up my support for what you're doing. And if I can do something personally, and maybe there are other board members that have access to people that could help. I do have colleagues in the media, and if I knew what the campaign was or knew what you were doing, I might be able to talk with them and see if I can get them to up their efforts on perhaps a pro bono level. And I'm sure there are other directors that may have some access to resources and maybe doing some things that could help as well. So I just want to offer up my assistance if I can be of assistance.
Thank you so much. We will absolutely take you up on that.
We have one additional hand, I think. Director Garza.
Thank you, Chair. Yes, as a individual that's at a federally qualified health center that serves county care patients, I just saw a notification today from the U.S. Department of Health and Human Services that we received an additional $700,000 specific for vaccination access and increasing our work with supporting patients. So I'm sure that's consistent with all FQHCs in the state and including the county. So we share in the effort with the county as well.
Thank you. Do we see another hand?
All right, thank you. Deb, I think you can advance down maybe 2 additional slides. There we go. So, yep. Our final 2 slides are just an update on our claims payment turnaround time. So still right around the 30-day mark. There was some uptick right as we hit the end of our fiscal year, which is typical as the financial systems roll over for the new budget. But we expect this will drop back down pretty quickly here over the final couple weeks of December. And then the final table just shows the breakdown by aging category. And again, you see some of that like at the end of the year in the 30 to 60 day category. But again, we expect to drive that back down here pretty quickly over the next couple weeks. And with that, I'm happy to answer any additional questions. Thank you.
Do we have any additional questions? Thank you. First, before we move on, I'd like to acknowledge that Director Robinson has joined us, so that he is here. Next, Director Garza will now review the Quality and Patient Safety Committee meeting minutes. Director Garza.
All right, thank you, Chair Taylor. The Quality and Patient Safety Committee met on Friday, November 18th at 10:30 a.m. And we're not planning to have a re-review of the metrics and the presentations from that meeting. But if any additional questions are raised, staff are present and ready to address those questions. The next meeting of the committee will be December 16th, next Friday at 9 a.m. The committee received the following reports, which are included in the minutes: the HRO dashboard. The committee reviewed the metrics on the following subjects: 30-day readmission rate, Stroger Hospital case mix index, clinical documentation, medical and surgical MS-DRG, Stroger Hospital top box score, patient experience, recommend the hospital, Stroger Hospital and HEDIS HbA1c 9%, greater than 9%. Receive regulatory and accreditation update, and again, those are included in the minutes. Received EMS and MEC reports, the Stroger Hospital and Provident Hospital medical staff. Action items were presented for the committee's consideration, and the quality committee summaries from Stroger and Provident hospitals were presented for informational purposes. And finally, the committee approved the following action items, which are also included in the minutes. Approve the following Stroger Hospital Department Chair initial appointment. Priscilla Augustin, MD, Correctional Health Chair of Department. Appointment term is from 11/17/22 through 11/17/24. And approve, and also approve the following Stroger Hospital Division Chair initial appointment. Amen Tulamat, MD, Pulmonary and Critical Care Chair of the Division of Pulmonary, with the appointment term beginning 11/17/22 and concluding on 11/17/24. And finally, approve Stroger and Provident Hospital medical staff appointments, reappointments, and changes. The committee did not go into closed session, but we are not expecting to review that information. I'm sorry, I stand corrected. The committee did go into closed session, but we are not expecting to review that information. So the minutes are being presented for the board's consideration as part of the combined motion to be made later in this meeting. Chair Taylor, that concludes my report.
Thank you, Director Garza.
You're welcome.
Next, in Director Ryder's absence, I will review the Finance Committee meeting minutes. The Finance Committee met on Friday, November 18th at 9 a.m. The next meeting of the committee will be held on Thursday, January 19th at 9 a.m. The committee considered the following action items, which are included in the minutes. Conditionally approved 23 contracts and procurement items. Number 7 and 21 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee whose fiscal impacts are greater than $1 million, which are highlighted for your information. During the discussion, we had a couple of follow-ups and requests. During the discussion of request number 4, the request to execute contract with Zepinga, DBA, Food Smart for food and nutrition services for county care members. Director Harrington recommended that the board receive a future update on how the program is working. Is there any change? Specifically, are there any changes or improvement in the health status for members who receive those services? We would also like a qualitative data included in the report in terms of how, looking at how are they consuming the food assistance provided. The update is tentatively scheduled for February 2023 for the Finance or Managed Care Committee. Request to number 10, request to extend contract with Vizient Group Purchasing. Director Story, your hands, acknowledge your hands raised.
Yes, with regards to the food service and nutrition, what is the level of MWBE participation in this? This is a San Francisco vendor, so I'm concerned about the dollars that are hopefully circulating in the Chicago metropolitan area in terms of MWBE participation.
Morning, Director Story. This is Aaron Gleaner, Chief Administrative Officer with County Care. I can answer that. So the MBE participation on that contract is just over 39%, and around 70% of the total food benefit itself will be distributed locally, either with nonprofit or MBE, WBE participating firms.
Thank you.
See Charles Jones also.
Yes, good morning. Charles Jones, Chief Procurement Officer. So the responsive letter back from the Office of Contract Compliance is 38.7%, roughly 39%, like Mr. Galena said. So we do have a responsive letter back with 2 MBEs and 1 WBE. Thank you.
Thank you for addressing that. Also, Director Story, your hand still raised, or is that additional question, or just okay? Thank you. With regard to request number 10, the request to extend contract with Vizient for group purchasing organization services, Director Story requested that a specific timeline be provided at the Finance Committee, at the next Finance Committee meeting on the request for proposals, RFPs, rather, and the transition process for the replacement of those services. And I assume that that's going to happen on the next Finance Committee meeting. During the discussion on request number 16, the request to amend and extend and increase the contract for Maxim Healthcare Services for temporary staffing for operations, Director Story requested that the following be provided in the December 9th board meeting: total number of FTE equivalents, then the delta to date with regard to number of positions filled and the number of positions being filled by temporary staff. And then request regard to request number 23, request to extend the increased contract with Quorum Health Resources for consulting services, consulting and accreditation readiness services. Director Story requested the need to extend the contract for 1 year. Mr. Rocha indicated that he will arrange for a briefing on the contract with Director Story and Dr. Eric Mikaitis, the Chief Quality Officer. So those are in process. Director Story, you're acknowledging your hands raised.
Thank you, Chairman. I want to go on record with regarding these agency contracts is number 17 and number 16.
Okay.
My concern is that this is an extension of a contract from 12/15/2017. This is roughly $31 million, the life of these agreements. And we're talking about, in this case, paying a premium to supply transporters, support services, call centers. I have serious reservations about spending $31 million of the county's resources to recruit people who are local here in our community. We're talking about transporters, lab techs, phlebotomists, call centers, greeters. Those individuals live right here in our community. And I have serious objections to spending $31 million with vendors from Maryland and other organizations outside the metropolitan area to recruit people who live, from my perspective, right here on the west side or the near south side. We're competing with ourselves to recruit people who are at an entry-level role. These are not nurses. These are not farm techs. These are not IT folks who you're going to have to compete on a national level for. I don't see people who work in the call center, coming from Texas, Ohio. So I have real reservations about spending $31 million to recruit people who live in our community. I cannot support going forward on either one of these contracts. I would respectfully request that management comes back with a better plan for addressing how do we recruit people who live in Austin, who live in Inglewood, who live in Cicero, as opposed to spending $31 million for these outside agencies to do what we should be doing right here in the city of Chicago and in Cook County. I just can't wrap my brain around spending $31 million to recruit phlebotomists when we have people like the Cook County Workforce Partnership and other nonprofits that are out there trying to uplift this community. So I would not be voting to support the advancement of either one of these initiatives. So I want to share that with the rest of the body.
Director Story, thank you very much. I think that the best way to handle that is to discuss those specific items in the HR committee versus here. Before that's how they advance through to the finance committee.
But with all due respect, Mr. Chairman, I'm going to go on record as saying that I do not support and will not vote to approve spending $31 million over the life of these contracts to recruit people who live in this community by paying a premium to some outside agency.
I recognize that.
Thank you.
Thank you. Director Harrington, I think you raised your hand as well. No. Director Kenny?
I am not out of sympathy with Director Story's comments. Wherever we can hire people, that's preferable over temps. That said, the additional information that was provided as a result of earlier discussion on this topic gave me, at any event, some insight into how complicated this is. I was totally blown away, I think is the proper way of describing it, by the percentage of employees that we have hired who are in fact not available to work. There were several categories of employees where we have over 20% of our employees out on FMLA. It's hard to hire permanent people to fill those vacancies, since those employees will come back when they come off FMLA. But this gets very complicated. I don't think we should get confused about the preference for filling vacancies with permanent hires when we can. But by the same time, we have to be cognizant of the full set of realities that make this a kind of messy situation.
Director okay, thank you. Appreciate it. Thank your comments, Director Kenny, very much so. Director Robinson, I see your hand raised.
After hearing what Director Story and Director Nutting said, it seems it may be advisable before considering these requests to bring it before the committee again, because the statements are very valid on both sides, and I think it's worth addressing what Director Story is actually bringing up, and let's see if we can get the entire story. Then that may give us a better picture.
Thank you. Appreciate it. Appreciate that. Any other requests or comments?
Yes, this Director Garza, Mr. Chairman, I just want to go on the record to say I share the concerns. I think where we should keep resources, not just in the state, but in the county, that we as directors pay taxes, and we should, as opposed to going out of state, unless that expertise doesn't exist or there's some kind of profound better value by out of state. But I'd really love to understand that as well. So I just want to go on the record as saying that.
Mr. Chairman?
Yes, Director Bott, I think, is the next.
So I want to just also go on the record of sharing the concerns of Director Story and Director Coney and this thread of conversation. One of the things I would encourage is, how do we not leave this to chance? So I know that the team is likely thinking about this, and it's an important area, but anything we can do to hardwire conversation and questions earlier in the process, to the point of Director Robinson, that would be helpful. So I understand there's complexity on this issue, so it's not as clear cut, but I think strategically we should be aligned with what our Director Story is suggesting and act on that.
Agreed. Approved. Let's see who's next. Director Curry, and then we'll go to Mr. Richard.
Just a comment of support of the suggestion that Dr. Robinson made. If there is a path for that or a process that would bring this back to committee for appropriate additional discussion, so that we do have a full picture of the arguments and positions that are being taken on each, I think that would be the deliberate and feasible way to go. Just wanted to lend my assistance. Thank you.
Appreciate it. Thank you. Director Prendergast, and then we'll go to Mr. Rocha, because I think that one has the mic.
Yes, no, I just want to also second that, or state in support of the notion to bring it back to the committee to have further discussion and a fuller discussion.
Thank you. That'll likely happen in your committee, so.
And I'm happy to do that.
Appreciate it. Mr. Rocha.
Sure. No, I do want to make sure that everyone knows, and apologies, my camera's a little slow today, but I do want everyone to know that we take these concerns very, very seriously. But one of the things that we just have to share is that we have some limited options in how we can engage. We are doing fairs to hire permanent employees. But as Director Kedding said, when we have temporary positions, like in the form of COVID, that we need to put in to have individuals who are being able to assist with additional capacity, or to do screening, or things that we don't know if they will become permanent positions, or whether we're filling in permanent positions because permanent employees, we're filling in temporary positions because permanent employees are on leave. We don't really have a lot of mechanisms to bring in individuals because we have to go through our procurement processes outside working with vendors. So I want to be very clear that there are some nuances. It's not that management is failing on the job and we're just going to work with one individual. We are aggressively hiring. In fact, we've hired over, and you'll have reports from HR later on, well over 800 employees just this year alone. And so we are working very hard to try to get those employees We do not have the luxury of not being able to meet the clinical need of our patients that are coming in, and we have very short time turnovers to replace those, and sometimes only get a week, 2 weeks, and our hiring processes can take some time. So I do want everyone to know that there is a combination of both employee need, patient safety, and patient service that must be provided, as well as we have some, because we're a governmental entity, have some additional requirements on how we can procure, how we can bring in individuals when those are clearly temporary employees, not permanent employees. So sometimes there are, to fill permanent employees who have not been able to recruit in time. Sometimes they're filling positions that truly are permanent and employees in it, but we have robust offering services and FMLA and other leave packages that are offered as part of our compensation and CBA arrangements. So those employees are temporary. How we engage and bring those staff on also has procurement requirements and must meet the Shagnon ordinances and be fully compliant with our codes. So I don't want to give the impression that this is somehow a mass failure and we're just saying we're going to go with agency and that's it. There are very prescriptive ways, the way that we can bring on individuals to work with Cook County Health, very prescriptive ways, the way that we can fill those jobs under our CBA arrangements when there's a permanent employee that must be there. And then we have very high, ever increasing demands on patient requirements to make sure that we can meet those services, especially sometimes during surges, flus, RSV, others, where things need to happen very quickly and be dynamic. So I understand the concerns. We're happy to have this conversation, but I want to be very, very clear that this isn't just that we're relying on agency because we're failing to hire or we don't want to go look for employees. In fact, it's quite the opposite. We're working very aggressively to have people on board and be part of us, even given the resignation that is happening across every industry in our country, while still meeting an increasing demand of patients and having to honor our CBA arrangements, our procurement codes, our processes, and leave management. So I want to be very clear that's what these things represent. It's not just a dereliction of duty. And we're happy to go into the presentations of how those actually come forward and the processes and methods that we have to source our employees and our labor demands.
Thank you very much, Mr. Rocha. Director, raise your hand again. No.
Absolutely. I wanted just to.
I'm sorry, Director Pendergrass.
Dr. Pendergrass.
Okay, got it. All right, Director Story.
Okay. Let me be, I just want to state once again for the record that the support and the acknowledgement of the efforts of Israel's team and what they've done in a very challenging environment, I acknowledge. And, I support what Israel has brought to this organization over the last 2 years, the team that he's building. But my concern is still the fact that we're looking at an organization that's been doing business here since 2017. And I hope that this look back will give his executive management team an opportunity to maybe source different options. That's my only concern. In no way am I being critical of the leadership of this organization with respect to the procurement, because we're all extremely sensitive to the challenge that Israel and his team are facing today in a very, very tight labor market. Mine is more structural. My concern is more structural in terms of relationships that this organization has with vendors. So thank you very much for an opportunity to express that to the group.
Thank you very much, Director Story, and also all of the other directors who highlight the comments. I think the right course, and also Israel, thank you for the edification, quite frankly, as well. The right course of action is we will actually, as we talked about, we'll defer approval of those contracts to the next meeting. And then we'll come back and, as we talked about, have the discussion within HR with additional details and then move forward. Okay, so we'll defer those, extension of those. Moving forward, the committee also received, we received and filed grant award related items. The committee reviewed the following reports, which are also included in the minutes: the Minority and Women-Owned Business Enterprise Report, report of one emergency purchase, the report of the September 2022 year-to-date financials. The action items, reports, and presentations from the committee meetings are included in the meeting minutes. If there are no other questions on the information, the minutes themselves are being presented for the board's consideration as part of the combined motion with the revisions I noted earlier. Next, I think we have 3 contracts that are being presented directly to the board for consideration. And we'll review those transmittals. I think the first transmittal will be reviewed by Erin Galena, Chief Administrative Officer, Health Plan Services. Mr. Galena.
Good morning again, directors. The item in front of you is an increase to a contract with our PPM. This is for our Medicare line of business. And I do want to be clear, this is the line of business that we are exiting at the end of this calendar year, so at the end of 2022. The reason for this increase is to allow us to pay out the final claims amounts related to the calendar year 2022 period. Providers have a certain amount of time to bill those claims, and so we expect to continue to receive claims over the next few months. And this is solely to allow us to pay out those final claims amounts and close out this line of business. With that, I'm happy to answer any questions.
Thank you, Mr. Galena. The next is regarding clinical, and Dr. Peter Hart, Chair of the Department of Medicine, and Dr. Rudy Kumaplay, I think I'm saying it, Kumaplay, Medical Director, George Hospital, Kumaplay, will review.
Good morning, Chairman Taylor and directors. Indeed, I'm Peter Hart, Chairman of Medicine. We're requesting an extension and increase in the Hecton Institute of Medicine contract in an amount not to exceed $2,150,550 for a period of 6 months. This contract would assure continuity of funding for clinical research staff and other personnel who are Hecton employees. It will fund consultants to provide direct patient care for patients who are in the Cook County system, free some of our principal investigators to perform grant activities, and will also fund clinical department educational needs that are needed within the Cook County system. Thank you, and I'm happy to answer any questions.
Thank you, Dr. Hart.
Thank you.
Next in Operations and Development, Craig Williams, Interim Chief Administrative Officer, Operations and Development, will review.
Good morning, thank you. This is a execute contract request with Stryker to obtain 25 additional med-surg beds. The total contract amount is $454,736. The majority of that is for the capital for the beds, $412,000 of that. The remainder is freight and a 3-year warranty. These 25 beds will be used to expand our services at Providence. Right now, we operate 25 beds at Providence on 8 West, and 13 of those rooms have the ability for a second bed, so they've become semi-private rooms. So 13 of the beds would go to expand those beds on 8 West and go from 28 to 38. And the remaining 12 would be used to build out our new observation unit, which will be on the 3rd floor at Providence. Any questions?
It looks like we don't have any, so thank you very much.
Thank you,
Williams. I'll note that number 3 is pending review by contract compliance. Next, if there are no other questions on the minutes and the action items being presented for consideration, we can move on to the combined motion. And so I'll beg your indulgence because it's long. Combined motion. I'd like to entertain the following combined motion to approve the following. Item 4A, October 28th board meeting minutes. Item 4B, November 18th meeting on the Human Resources Committee, which includes 4 proposed CBAs, including economic package, wage increases in healthcare between the County of Cook and SEIU Local 20 CTW/CLS representing ACN, ACHN attending physicians and dentists, CERMAC attending physicians and psychologists, Provident attending physicians, and Stroger Core Center attending physicians, and the proposed amendments to the CCH severance policy. Item 4D, November 18th meeting of the Quality and Patient Safety Committee meeting, which include one Stroger Hospital Department Chair initial appointment, one Stroger Hospital Division Chair initial appointment, and Stroger and Provident Hospital medical staff appointments, reappointments, and changes. Item 4E, November 18th, minutes of the Finance Committee meeting, which include contracts and procurement items and grant award related items, with the exception of request number 16 and 17 contained within the contracts and procurement items, which were deferred, and item 5A, contracts and procurement items containing request number 1 through 3, subject to completion of the contract compliance, subject to completion of a review by contract compliance. Thank you. Do I have a motion?
So moved. Director Harrington.
Thank you, Director Harrington. Second.
Second, Director Curry.
Thank you, Director Curry. The combined motion has been made and seconded. Madam Secretary, please take roll call on the combined motion.
Roll call vote on the combined motion. Aye or nay, Director Bott? Sorry. Director Bott? He might have stepped away. Director Curry?
Aye.
Vice Chair Deere is absent. Director Garza?
Aye.
Director Harrington?
Aye.
Director Kim is absent. Director Ketting?
Aye.
Director Prendergast? Director Ryder is absent. Director Robinson?
Aye.
Director Story?
Aye.
Board Chair Taylor?
Aye.
And I'm going to circle back to those who were absent the first time. Director Bott? Are you present, Dr. Bott? Okay. And Director Prendergast? If you give me 1 minute. Okay, apologies. You have 7 yeas and 5 absent.
Thank you. Looks like the ayes have it. The combined motion carries. The next item is my report, which was already provided earlier in the meeting. However, I would like to, I'd like to highlight one acknowledgement, that being that this past Monday, December 5th, was the 2nd anniversary of CCH. Israel Rocha's joining us as CEO. So we'd like to acknowledge, congratulate him for that 2nd anniversary. And also that today is his birthday. So Mr. Rocha, happy birthday as I turn the chair over to you to deliver your report.
Thank you. We'll leave which birthday it is just between us. But
there you
go. Happy birthday, Dan.
Happy birthday.
Happy birthday.
Thank you. Happy birthday.
Happy birthday.
Thank you all so much. And thank you. It has been an amazing 2 years. Want to actually recognize 2 of our very, very talented and exceptional physicians who are with us to give part of my CEO report. I want to dedicate, as we've all been hearing in the news, we have a tridemic, is what they're calling it. We have RSV, flu, and still COVID, which is among us. As much as we labor to try to close that chapter, it seems to want to continue to be an epic novel. But we do have some great leaders who have been able to shepherd us through this. pioneer some great resolutions to be able to help patients cope with these viruses, and then also to give an update of what our community is seeing. So wanted to turn over a majority of my section today in the report to be able to present to the board and to the community a respiratory virus update, what we're seeing, where we're going, and what we can expect as we enter this holiday season, and we're going to be gathering with our families. They also will share some tips that we all can take forward so that we can be healthy. No time to be able to prevent than like the present. So with that, I'm very happy to bring forward Dr. Lamar Hasbrook, who is our COO for Cook County Department of Public Health, and Dr. Sharon Welbel, who is our division chair for infection and hospital epidemiology. So take it away, guys. Thank you.
Thank you, Mr. Rocha, and good morning, Chair Taylor and directors, and welcome to the new directors. So just a few high-level slides here to kind of put this into context. So this is our COVID epi curve, and you can see on the far left, January, almost a year ago, in terms of hospital admissions, it's very, very high. Towards the tail end to the right, you'll see it's kind of ticking up a little bit. So the take home from this is that there is a slight uptick. There are many variants. We've had over dozens of variants so far, a handful of variants of concern. So we continue to see variants as this virus continues to mutate. The good news is that the bivalent boosters are effective. And I have mentioned the getboostedcookcounty.com campaign that we have. I'll be sure to send some information to Debbie to send to the board about that campaign. Again, it started last month, and it will run for about 5 or 6 months. Next slide, please. Okay, so this slide just has 2 panels. One on the left kind of gives the highlights around flu or influenza. The one on the right is RSV. These 3 together make this triple threat season. You can see influenza, the risk level is high. There's nearly 6% of ED visits of folks who are presenting with influenza-like illnesses. I understand that the protocol is to test all of these, so you'll see on the slides with Dr. Welbel the actual numbers of how these strains are breaking down. 25% of lab specimens, those that we do test, have been positive for influenza. So those are some of the highlights around there. We're seeing folks who are younger than age 5, or 16% of the ED visits are folks who are younger than age 5, those obviously who are risk for RSV as well. And we're seeing just basically an uptick, or the highest rates in about a decade, of influenza. So this is a very active flu season. And we're also seeing a disturbing pattern, or a concerning pattern, of folks, pregnant women and some children with lower vaccination rates. And we've talked about some of those on this call already. In terms of RSV, again, it really is targeting kids under 5, those who are most vulnerable, are typically under age 3. It is, for the most part, a condition or influenza-like illness for young kids, but folks who are older, and they're 65 plus, and those who are immunocompromised are also at risk too. So adults do get it, but it really is, we're really concerned about kids for the most part. We can see that it peaked in early November, and it seems to be trailing down or coming down. But again, with all of these influenza-like illnesses, there has been a stress for capacity, and in particular, when you're talking about pediatric ICU and beds around peds, again, there's a concern. So even though it's trailing down, we are still concerned and still very much trying to get the message out through media and other means with our community. Those are my slides. I'm going to hand it over to Dr. Welbel, who can give some more details.
Thank you, Dr. Hasbrook. Just waiting for my slide. Next slide, please. Yeah, so I'm going to give you a little bit of information about our rates that we're seeing within Cook County Health, our system for COVID, influenza, and RSV. So you can see this is our COVID data. This goes all the way back to the beginning of the outbreak. You see about a year ago when we had Omicron 1. And then we've had the various other Omicron variants, but in the red line, you can clearly see that our rates are going up, and our positivity rate is over 10%. It's almost 11% now as of today. And just to give some context to that, back in March, April of this year, COVID positivity rates were less than 1%. So this is a high positivity rate, and these are for lab confirmed cases. We no longer are seeing data on test positivity rates in the nation, the state, or the city because there's so many people who are doing home antigen tests, and it's hard to find that rate, but we do have this rate for everybody coming into the hospital and getting tested or being seen in ambulatory or the emergency department. Next slide, please. So this is our flu data. This was as of Monday. Actually, numbers are higher now. But what I just want to show you is the very robust and rapid rise of flu cases during this season. As Dr. Hasbrook has stated, this is really unprecedented. And in fact, there was a report that at the end of November, it was on one day, November 26th, there were more than 34,000 positive flu tests that were reported to CDC. And not everything gets reported to CDC, but that's more positive flu tests than have been reported in any single week during any flu season as far back as 1997. So this is a very robust flu season. We're largely seeing H3N2, which is a more virulent strain of influenza than we've seen in prior seasons when we see, for example, H1N1, and it does and therefore we will see more hospitalizations and deaths due to this. And by the way, for COVID hospitalizations, in addition to cases increasing nationally and locally, hospitalizations and deaths are also increasing. And we're talking about vaccines, and nationally only a little bit over 13%, 13.5% of people have been boosted with the bivalent booster. The good news is that yesterday FDA did approve bivalent boosters for kids as young as 6 months. Next slide. And this is our RSV data. Some better news here. You can see we plateaued and are decreasing. We are in fact decreasing also in the city and the state. The mid-Atlantic states are plateauing and decreasing. The Southeast states are also decreasing, but there are still many areas in the country with raging RSV as well. So, you know, of course, we, as everybody, there was a wonderful conversation about how to increase vaccination rates, which is so important. Everybody should get vaccinated who can get vaccinated. Now almost everybody is eligible to be vaccinated against COVID, including with the bivalent vaccine. We know most of our variants right now are BQ.1 and BQ.1.1, but we do hope that the vaccine still creates some protection against those variants. Flu vaccine this year is a pretty good match. Flu vaccine is generally 40 to 60% effective at preventing illness, and this year it's found to be about 50%, which is great. And still, though, it will prevent hospitalization and death, much like with much higher rates, much like our COVID vaccine. So we want to get vaccinated as much as possible. I strongly recommend at this time with raging respiratory viral pathogens, a lot of gatherings, that people wear a mask when they leave their home and go to any other indoor space, and even outdoors when you're close to other people. Masking, there's so many well-fitted masks that are available. It is an incredibly safe and effective mitigation intervention. Unfortunately, there are not many non-pharmaceutical interventions being used right now, but masking is one of them that can be done. I also recommend that during holiday gatherings, 1, if you're sick, don't go. 2, if you're not sick, at a minimum, do a rapid test. I suggest doing 2, 12 hours apart. Avoid people who are sick. Increasing ventilation is very helpful and really quite effective. So, you know, opening windows, so on and so forth. Let people know to bring a sweater. And if you have access to HEPA filters, I highly recommend using those. They are quite effective. There's a lot of good data that they do prevent the spread of viral respiratory pathogens, certainly not 100%, but do help in decreasing. If you don't have one and you're able to purchase one, I do recommend doing that as well for one's home. And I think that that's about it. We are seeing increased hospitalizations. We are averaging about 20 patients in the ICU for COVID. We have a number of influenza patients, both for both. We have patients in the ICUs currently, and we still are seeing, and we're still seeing RSV patients in the hospital. We have 2 right now. So that's my report on the respiratory viral pathogens. Open to questions.
Any questions for Dr. Welba or the team?
And I apologize, I didn't actually read the last slide, which does show the availability of the bivalent vaccines here at CCH. You can see that. It's really nice. As Ms. Mora mentioned, people can either make an appointment or can walk in, and you can get more information at vaccine.cookcountyil.gov.
I have one question, and I wanted to raise it earlier, but the hard to reach members or patients are the ones who really create the problem to a great degree because of lack of getting vaccinated. Are there any efforts to do a campaign where you go into the homes to actually vaccinate them? I know the city is actually currently doing it now, and they've been doing it for several months. I'm not sure if we're doing anything on this side.
Dr. Hasbrook, do you want to talk about our extensive efforts in those areas?
Yes, so we're doing exactly that. We have a couple of contracts that this board has approved over the past several months that are doing just that. So it is community, so bringing it to them, what we call hyperlocal vaccines or vaccination pop-ups, if you will, with probably a couple of dozen different entities that are in the community. And then we also have another contract that does at-home vaccination as well. So there's ways for them to go on our website and request this, and we'll actually come out to them and do the vaccination in home. So we do both of those.
And also want to commend Dr. Hasbrook and his team at CCDPH for creating the recent Boost Up campaign. So I want to give some a plug for Dr. Hasbrook and his team. They're also going into very specialized events with large community presence to be able to talk about the need to get vaccinated and where they can get these services and how they can get individuals who cannot leave homes to be able to get home assistance or vaccinations, and then creating additional events following those large education events. So do want to congratulate the public health team for their wonderful work in the Boost Up campaign.
Thank you, Mr. Rocha. So I'll just mention last Saturday, it was the Winter Jam hip hop concert at the United Center. We were there. And then a week or two before that, there was a large gospel concert that we were at, and that I was interacted with the host on stage as well, promoting not only the Boost Up, but some other things that we do. So thank you for that.
Out of curiosity, at those 2 events, do you then actually have someone on site to be able to give those folks vaccinations?
No, it's a little bit cumbersome and awkward, but we do have sometimes palm cards or other handouts with QR codes, and then we're on the large screens with QR codes on our website. So we have that mechanism for call to action, so they can actually drill right down to our website and request any of these things. But no, it's been too cumbersome to try to set up actual vaccination at these large venues.
I can appreciate the complexity, but I recognize if you can get people at the moment when you have them excited, you may see an uptick in your ability to get more people vaccinated. And again, I recognize it is complex.
Yeah. We'll explore that in partnership. We have done that. I'm sorry, Dr. Roba. We have done that in a lot of our events in the community. So we did it at the Bud Billiken Parade. We've done it at large events before. We partnered with the White Sox to be able to do some events with them and games and had some initial kickoffs, things like that. We're trying to see if we can do that with other sports teams and large events. So we'll definitely partner and see how we can partner with our teams across our enterprise to partner and be able to do that, and definitely a good idea we can take forward. Dr. Webber, I'm sorry.
Yeah, no, nothing to add to that. Thank you.
The other piece I would take, and again, I recognize the complications, but if it's possible to go to the different elementary schools and maybe team up with the CPS to have the parents give permission, then you may be able to make some traction into those hard to reach people in the numbers, because it's hard to say no and you actually present the right message and have that moment of decision. Again, just a thought.
Absolutely, we will take that. I know that both our Cook County Department of Public Health and our infection prevention team work with different districts to share education. I like the idea of seeing how we can follow up and be partners and being able to do that with the families. So thank you. We will definitely take those ideas back and then see how we can coordinate our hyper-local vaccine teams with the Cook County Department of Public Health teams and the Boost Up campaign and look for opportunities to be able to align those. So thank you. Great recommendation. So with that, if there's any other questions for the team on the vaccination or report about the tridemic that we're in. So hearing no questions, just want to have a few system-wide updates to be able to share. So next slide. First, we wanted to be able to give you an update that to address an expected seasonal surge in hospitalizations due to respiratory illness, inpatient capacity at Providence Hospital is being expanded from 25 beds to 38 beds through the introduction of semi-private rooms. Adult and pediatric surge space is also being added to Stroger Hospital, including a pediatric step-down unit. As you're aware, RSV has led to a large number of pediatric patient admissions happening across the city, and pediatric care and especially pediatric inpatient capacity is something that has been limited over the last few years. And so Cook County Health has been happy to be able to step up and increase and augment our current operations. I want to commend our teams for working diligently to make sure that we could be able to handle that surge over the last few months. Cook County Health also plans to add 2 mobile MRI machines to the Stroger campus in the spring to increase access to radiology services and ensure just-in-time services for those who need MRI capability and testing. Telemetry has also been expanded to the Stroger observation unit with the goal of reducing the amount of time a patient spends in the observation unit and an inpatient bed, and to better coordinate our services. Next slide. Also want to discuss the expansion of rehabilitation services to Providence Hospitals in progress. We are going to be taking some outpatient rehabilitation services to the Providence community to make sure that people have less of a travel. When people are undergoing rehabilitative services, we want to be able to minimize any additional travel or extension that they need to do. So we're very proud to be bringing back rehabilitation services to Providence Hospital on an outpatient basis. We currently offer physical therapy on an inpatient basis. Environmental Services has launched a project to decrease turnaround time at Stroger Hospital. I want to congratulate the team that to date, their pilot programs and their initiatives, the team has reached and maintained a 25% decrease in bed turnaround time, resulting in an additional 117 additional days of bed capacity and availability during a 60-day time period. So congratulations to our operation team for their improvement in turnaround time. This is a remarkable improvement. Cook County Health and the Cook County HIV Integrated Program hosted an event on December 2nd in honor of World AIDS Day. The event celebrated the medical advancements made in the last 40 years to treat HIV and AIDS and to reduce viral transmission and enhance viral suppression. Congratulations to our core team and to our HIV team for their historic work in being able to do this. This is truly an area where Cook County Health and our core team has distinguished themselves in creating opportunities for patients to be treated in a comprehensive environment. Next slide. So that brings us to our presentation for today. And just want to be able to, again, as Chairman Taylor discussed, want to thank the Cook County Health team, want to thank the entire board for being supportive. This has been a very, very special year for Cook County Health. We had some very, very special milestones. We hit the milestone of giving over 1 million vaccines for COVID and being able to do that directly as a care provider. Our CCBPH team gave another 1.5 million vaccines through their coordinated effort to hospitals and other providers. When refugees and asylum seekers came to Illinois from other states, Cook County Health quickly established assistance and was able to create the refugee and asylum clinic to be able to help both ensure the safety and needs of our community and of the patients as new people were coming in, and did that in under 48 hours and continues to serve over a large number of patients that have come through the gates of our program. And so I want to congratulate our team for doing that in a very short amount of time and being able to be there and to extend the legacy of what Cook County Health means, that everyone is available to be able to safeguard themselves and their person in a time of need and to safeguard their health. And so I want to congratulate our team for that. Also, when monkeypox came forward and our community had many, many challenges in being able to address that, again, our core team and our ambulatory care team and our Cook County Department of Public Health acted quickly to set up some of the first treatment centers and went forward to be able to bring drugs and availability and resources and immunization and vaccines to be able to ensure that our community was safe, created testing campaigns and information, as well as providing direct vaccination across the community to all in need. And so I want to congratulate both our Cook County Department of Public Health team who did education and our core team who did direct vaccination, and our ambulatory care team who then expanded the vaccination rate from core to several sites in our ACHN network, and have been able to give vaccine to thousands of individuals who needed it, and have really helped to bring that to an all-time low number of cases that are being spread. And then, of course, we cannot forget just the ongoing care and the education that we do across our community. Also want to thank, as you heard earlier today, our CIRMAC team was recognized as a Center of Excellence for Substance Use Misuse Programs. This is something very important that we're working to recognize in our CIRMAC Health Program as we're working with justice involved patients to make sure that people get resources that they need and they're in their journey to rehabilitation. And so we're very excited to be able to not only have those services, but to be recognized as a Center of Excellence program. And then also most recently wanted to share that we have been working with several organizations and we'll be having some exciting announcements that Cook County Health has been selected as a demonstration Center of Excellence for equity and inclusion programs. And we'll have more dates to come forward on that is coming as well. And you have seen throughout these presentations that our leaders, our programs from across the country have done incredibly well, including several of our residency programs being recognized in the top 10 of the United States by other providers throughout the country in Doximity and other programs. They were recognized in Modern Healthcare, Cranes, and Becker's for being top programs in the country. And so from every aspect of our system, from what we do with justice involved patients to our county care being recognized as a top performer in quality throughout the state and rankings, we do want to be able to just recognize that all of our Cook County care, from our public health department to our county care team, our CIRMAC team, our acute care, our ACHN, we're working combined and in an integrated fashion to bring more services to the community. And while this year was impressive, I guarantee you what the team has been putting together for next year will be even more impressive. So look forward to the days ahead, the work that we'll do together. Thank you to the board for your leadership and for your service and your mentorship in helping us to make us a better organization. And thanks to the community and our patients for putting your trust and faith and helping us to have another year of service. Thank you to everyone, and we're very happy to have this be our last meeting for 2022, the work that we've been able to do and the trust that people have given us. Thank you.
Thank you, Israel. We really appreciate it all again, and thankful all the work that you and the team have done in service of serving the residents of Cook County. We really appreciate it. At this point, I believe the board will now go into closed session. Action is not anticipated to be taken in open session after the closed meeting is adjourned. Given that, I'd like to entertain a motion to go into a closed meeting pursuant to the following exceptions to the Open Meetings Act 5 ILCS 120/2 C1, 11, 12, and 17. Can I have a motion, please?
I'll make the motion, Garza.
Thank you.
Second.
Thank you. The motion has been made and seconded. Madam Secretary, please take the roll call vote on the motion.
Roll call vote on the motion to go into closed session. Aye or nay, Director Bott?
Aye.
Director Curry?
Aye.
Vice Chair Deere is absent. Director Garza?
Aye.
Director Harrington?
Aye.
Director Kim is absent. Director Ketting?
Aye.
Director Prendergast? is absent. Director Ryder is absent. Director Robinson,
Aye.
Director Story. Director Story,
Aye.
thank you. And Chair Taylor.
Aye.
You have 8 yeas and 4 absent.
Thank you. The ayes have it. The motion carries. We will now go into closed session. Directors, I'll see you.